Hello, everyone. Today we are talking about bleeding disorders. Bleeding what, you say? Well, you may have never heard that term before, and that is no problem. Let's discuss what they are, how to recognize one, and why anyone should even care in the first place. Let's dive in. Bleeding disorders are a group of conditions in which the blood does not clot properly. So injuries take longer to heal and bleed more compared to people who do not have a bleeding disorder. About 1 in 100 women and girls in the United States have a bleeding disorder, and most are not diagnosed. Most girls who have a bleeding disorder are born with it. It is inherited, meaning passed down from one or both of their parents. The most common symptoms of a bleeding disorder are heavy menstrual bleeding during your period. Check out what this really means. Frequent nosebleeds or bleeding from cuts or injuries that last longer than 10 minutes. Easy bruising, like bruises that form from just brushing up against a counter or that you can't remember what could have caused them. Heavy bleeding after surgery or outpatient procedures, like getting your tonsils out or at the dentist's office. Heavy bleeding or hemorrhaging after childbirth or miscarriage. Your symptoms may not feel like symptoms because you have experienced them your whole life. With heavy menstrual bleeding, your periods may have been heavy and long for years, so for you may feel it's just how you bleed. Your family members may have told you that heavy periods are just normal for the women in your family. But wait, don't forget what we discussed before. Bleeding disorders are inherited, so it is possible the child, mother, and grandmother are all exhibiting the signs and symptoms of a bleeding disorder that runs in their family. We bet you may have even come up with some good ways of coping with those symptoms, but it is still important to determine what's causing your bleeding. Why, you ask? Well, these symptoms can really impact your life. Have you ever missed days of work or school due to any of these symptoms? Have they kept you from wanting to attend social gatherings? Enough is enough. Life doesn't have to be like that. Also, knowing the cause of your symptoms could allow you to get life-saving treatment if you have a major accident or injury, or get better care and support through pregnancy and childbirth, if that is or will be your thing one day. Look, effective treatment is available. Life can be better if you know.